I want to thank everybody for attending this morning's launch on the fentanyl patch exchange program. On behalf of the Sarnia Police Service Board and Police Service, I thank you for attending this occasion. This is indeed a good occasion. Community policing involves everybody in public safety. I mean, the police, of course, do the enforcement, but we all come together when we identify a problem in a community, and that's where all our stakeholders are important, is that we all have input, very valuable input, with a problem, and the problem, of course, is fentanyl, as you know. It's no surprise to anybody that fentanyl has been a problem in our community for a long time, that it's in the wrong hands and it's been used for the wrong purposes. Prescription drugs in itself is a problem in this community, more so than maybe other communities. Some time ago, Constable Mike Howell from our Vice Squad came to me and said, we have this problem with fentanyl, and I asked him, then you look into it, you develop a program, you initiate a program to address the concern of fentanyl. And Mike, I thank you for the time and effort and the work that you have put into bringing people together. Mike speaks on behalf of the Chief of Police for this problem. And for everybody that is involved in this, from the Officer of Health, to our Deputy Warden, to other police services, to the community, I say thank you that we now have, or will have, the launch of a fentanyl exchange patch program. I read occurrences every morning. One of the first things I do is read occurrences, and sudden deaths are not uncommon, and it's sad to see that from time to time we have sudden deaths associated to fentanyl overdose, to other prescriptions, but fentanyl particularly, because a lot of people don't realize how powerful this drug is. So again, thank you for attending. I'll be calling upon a number of people for their brief comments, and I'd like to start with the County of Lambton Deputy Warden Ian Veen to step up.
The County Council has voiced its strong support for the Patch for Patch initiative, and we are very pleased that the important program has been launched here in Lambton County. Lambton Public Health has demonstrated leadership in working with the right partners to make the initiative a success. The Patch for Patch program is a partnership, and the county is committed to working with our partners, including the police and the healthcare providers, in order to ensure the success of the program. Thank you.
Well, thank you to everyone that's here, and particularly Mike, who's worked so hard on this. And it could have happened perhaps anyhow, but it probably would have been years away. And it was Mike's leadership that was persistent, and certainly educated myself. I had very little knowledge of fentanyl. And with the presentation, I think, Ian, you would agree when Mike came to County Council, I was just listening to my colleagues around me. They didn't know what he was talking about. And when community leaders don't know what someone's talking about on a very serious problem, then you know you've got a very serious problem. And so it was very profound what happened, and then community health became engaged, and that was important too. I have a statement the family asked me to read, which I'm very honored to do. And I told them I think it would be emotional for them to do it, and it would be emotional for me to do it. But we will do that. But there's a couple things I want to mention. If there's anything that points out the crying need for a detox center in this community, withdrawal management, whatever you want to call it, it is this issue. Yeah, I think it was 15 years ago, Phil, that there was a woman that died in downtown Sarnia. She was drinking turpentine in the morning. Sort of awakened me to the need for a detox center, withdrawal management. And the county came on board, and others have come on board, but it still hasn't happened. It should have happened yesterday. It should have happened a year ago. It should have happened 10 years ago. And out of this initiative, I would hope that the pressure would build again to get on with getting a proper facility here to at least get people to that stage where they can go to where they need to be treated. Not the absolute answer. We all know that addictions are falling down once, falling down twice, falling down 3 times, often more. But it has to happen. So I would like to read the statement from the Hicks family. It is very short and brief, but it's, I think, very poignant. It says, "We'd like to thank all those involved in making this endeavor happen. Our sincere gratitude goes out to everyone who took the time to listen, for allowing us to be Ryan's voice. A special thank you needs to be extended to Mike Howe. His ongoing effort and dedication made the success of implementing this program a reality. Hopefully the fentanyl patch exchange program will make a difference in our community and lives can be saved. And this is from Laurie and George, Brianne, Amanda, and niece Jelia. And they're all here today. So it is very much appreciated. And know very difficult for you, but yeah, I think you can take great solace for Ryan and what you've accomplished out of a very difficult situation personally. So thank you for that.
Yeah, I don't think that anybody can express the devastating impact of fentanyl and other prescription substances better than people who've experienced that with a loved one. And I don't think anybody could express the potential hope of a program like this better than you folks either. So I will stick to just saying that I think this is a valuable and important partnership that we've all started, and I think that it is hopefully going to set the stage for working together on this issue and on future issues, because as we all know, and as Chief Nelson said, this is a problem that is larger than fentanyl alone. So I'm hoping this is a really important first step and a start towards working together on a larger substance misuse picture. And I think this is a good start, and I think we've got the right people on board for it. So, and I would thank the Sarnia Police for coming to us with this as an initiative from that is spreading around Ontario, and we're happy to be a part of it. So, thank you.
Good morning. I'm very proud to be here on behalf of Sarnia Police, the OPP, Lambton Public Health. This has been a challenging endeavor to get this to this point. A lot of work has gone involved, a lot of meetings, a lot of emails, but I'm very proud to have this for our community. And it's a very important step that we need to try and combat this difficult issue with fentanyl abuse. This program, I didn't develop it. It's been around from the Ontario Chiefs of Police. It's started in North Bay, and it's kind of propagated its way out from there. But we've seen the success of how it's worked in other communities, and that's why we brought it here, because our statistics are staggering for our abuse. And this program will, when it's implemented, it will become successful in combating this. It will reduce the amount of illegally diverted fentanyl that we have on our streets. There's no doubt about that. It just takes the buy-in from our community partners, and like I said, once the doctors, the pharmacists, and patients have been educated as to the need of this, they understand that why we've developed this program and why it is so needed in this community. So, like I said, I'm very proud to bring it forward on behalf of the Hicks family and others, and I'm very happy to see this day finally. So, thank you.
476 is the amount of motor vehicle collision deaths that happened in 2013. 577 is the amount of opioid overdoses that happened across the province. If you take a look at the Ontario Drug High School Survey, 12.4% of high school students in 2013 self-report using prescription opioids recreationally. As a province, we know this is a problem. The Fentanyl Patch for Patch program is something that we champion, push across the different provinces with public health, with the Ontario College of Pharmacists, and with the College of Physicians as well, and all our different community partners, as one step to help with the prescription drug problem that we see across the province. Thank you very much for taking the time. Thank you, Mike, for setting it up here in Sarnia area. It's a very valuable program, and it's going to be something that sort of helps out your community. And us with the Lambton OPP as a representative from the province as well, and myself working within the province, we thank you for taking your time today for coming out and supporting this program.
It's great to be here today, and as a pharmacist we know that narcotic use and abuse in our community is a huge issue. Also, as pharmacists, we're oftentimes put in the situation where we're policing a lot of use, from a prescription dispensing perspective. So being part of this, seeing this fentanyl patch for patch initiative rolled out, knowing that other communities and pharmacists have been involved, it's great that we have Mike here as well from the police, definitely supporting, and Dr. Ranaday from Public Health. I think, as Dr. Ranaday spoke to, I think from a pharmacist perspective, this is a great connection and initiative because Ontario College of Pharmacists represents patients. We're all about patient care. When we make decisions at the college level, it's always to support what's best for the patient, and definitely this is an initiative that falls right in line with that. I'm glad to be here supporting it today. Thank you.